Listen to the sounds of people learning to hear.
Okay, say how many airplanes are in the yellow cup? Oh, I think 3.
These are the fortunate ones. They've found the way to hearing health.
Good, Jenny, that's good.
Listen, okay?
With the help of advanced treatment and technology, today, they hear the sounds of life.
I hear that.
Good, I shook it, okay? I'm gonna let Casey try.
Others are not so fortunate. Today, 20 million Americans suffer hearing loss that prevents them from communicating, working, and enjoying life as they would like to. 20 million. A whole city of people. The major causes? Chronic exposure to environmental noise.
Steve! Steve!
You got a bit too.
Congenital problems and aging.
What do I do?
Today, 3 out of 4 patients who need treatment for hearing loss are not getting it.
Mr. Bernard? Mr. Bernard?
Early detection and referral are the key. You can help. With your sensitivity and concern for patients, you can make a difference in their hearing health.
Mr. Evans, do you think you need hearing aids?
No, not really. But my wife's been bugging me for months. She says I'm hard of hearing. I don't think I am, but I don't want to hear her bugging me all the time anyway.
Sean doesn't listen to me when I talk to him. He pretty much ignores me. They told me that he'd grow out of it, but he's almost 3 years old now, and he still doesn't talk as well as the other kids do, and I'm really concerned about that.
Where I work, it's really noisy. And I've noticed that every night when I'm lying there and trying to get to sleep, there's this ringing in my ears.
Is that in one ear or both ears?
It's easy to detect hearing problems with these patients. Diagnosis will not always be this simple.
Any general medical problems, heart, lung problems, things like that?
That's why careful history taking and observation of hearing ability is so important.
Why don't we go ahead and take a look at your ears, Steve?
If you suspect hearing loss, an ear examination and basic hearing tests can be done right in your office to detect treatable problems.
Your right side looks okay. Let's look at your left.
Remember, a hearing loss is not just a medical problem. It affects a person's whole life, work, family, not just their ears.
Here are some ear protectors I think you ought to wear, especially at work, to help prevent further noise exposure.
Physicians are the crucial link in beginning early health care.
If you don't notice that your head noise decreases, that you ought to contact me, and then I need to refer you to someone else.
Referral sources for testing and treatment are available. Audiologists, hearing aid specialists, and otolaryngologists, professionals that can make a difference. No child is too young or adult too old to refer for testing, because testing can make a difference too.
Now I'm going to test to see how well you hear. When you hear the tone, signal by raising your hand.
This specialist is conducting audiometric testing to determine, first of all, if the loss is sensory neural or conductive. Testing paves the way for proper treatment, treatment that can make a difference. Many hearing losses are treated and corrected with medical or surgical therapy. Other patients, adults and children, are fitted with hearing aids by hearing aid specialists.
Bep, 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 bep. Did you hear me? Good. That's right.
Modern hearing aids are smaller, more comfortable, and powerful than ever before. Technology has improved their amplification system, so even soft, high-frequency sounds can be heard clearly. The canal aid is the most popular and least visible hearing aid used today for mild to moderate loss.
Yeah. Oh, that's much better.
Very good.
Behind the ear aids, in the ear aids, and body aids are also available. Assistive listening devices,
Wait a moment, I'm hearing impaired and my son's taken the amplifier off the phone.
like telephone amplifiers, special alarm clocks, and TV headsets are often used in addition to hearing aids. And speech reading classes for patients with severe loss help improve communication skills.
Fine, all right?
Dramatic treatment for the profoundly deaf, the cochlear implant,
1, 2, 3, 4. 1, 2, 3, 4. Back.
and the vibrotactile device. For those who cannot be helped with hearing aids, a way to hear the sounds of life.
7.
It sounds like if a mouse is talking.
A mouse is talking. Mickey Mouse or Donald Duck?
Go down, dogs. Do not play.
The fortunate, experiencing hearing health.
Jenny, that's real good.
What's that in your ear, Grandpa?
Oh, this is my new hearing aid Grandma had me get, and I can hear real well with it. And when she starts nagging me, I just turn it off.
Steve, it's Quinn time. Let's go get a brew. What's the deal?
Sean!
The unfortunate, 20 million, still experiencing the frustration of hearing loss that interferes with their ability to communicate and to enjoy life.
Trying to hear, but you can't. Yeah.
Hearing health professionals can make a difference. Proper testing to determine the magnitude and cause of loss can make a difference. Treatment, whether medical, surgical, hearing aids, or therapy, can make a difference. There is hope. Research and technology, testing, treatment, and hearing devices replace hearing loss with hearing health. It all starts with you, with your caring and concern. Combined with careful observation, you can detect hearing losses early and refer patients to hearing specialists. You make the difference between hearing loss and hearing health.